Cindy, and I want you to go floss yourself. So I'm doing entertaining and educational videos about dentistry. I've been practicing here in Canada since 2012, and as the owner of my very own practice, Horizon Dental, I love finding new ways to brighten lives and create smiles. So make sure to subscribe to my channel and click the notification bell so that you can see my videos every single week. So for this week's video, I wanted to talk about a subject that I'm a little bit nervous about. I think it might get me into some trouble with the comments below, but I think it's worth talking about so that hopefully it will help somebody out there understand a little bit better how some of our dental fees and procedures work. So my practice, Horizon Dental, received a Google review a few weeks ago. And since the name isn't available, I wasn't able to sleuth out a lot of the details, but I'll do my best based on the information that I have. So this review reads, this is from Moonbeam 1303. As I have no complaints about the service I receive, I do not think a cleaning that was about 15 minutes long and a 2-minute visit from the dentist should cost $166. I do realize that you have overhead and other expenses, but I too also have expenses. So right off the top, I am really glad that Moonbeam 1303 felt that he or she received a good service during the visit to our office here. And let's be real, this is a 4-star review. This isn't a bad review, but it bothers me. I always look at these comments and I try to think, what could I do better? How could I improve our customer service? Dentistry is healthcare, but it's also a business. And I have found over the years that these are two really hard things to kind of mesh together. There's a couple of things that I can assume based off this review. First, that Moonbeam 1303 probably came in for an exam and a dental cleaning. This means that he or she has been to our office before. So this person isn't a new patient because they had a cleaning. That means that Moonbeam 1303 was probably most likely here for a 60-minute appointment with one of our dental hygienists. So here's why I think this is kind of a great opportunity for a video, because there are a lot of different procedures that are involved in kind of like your typical adult dental cleaning. And I thought I could explain a little bit what's involved in those procedures and how the cost is broken down, because I have a feeling that it is not exactly what you think. So I would like to refer to this lovely book right here, the handy dandy BC Dental Fee Guide. I do practice in British Columbia, and this baby is published every February by our BC Dental Association. So part of their job, is to evaluate our fees, and every year they determine if and by how much these fees should change. And as a dentist in BC, I don't have to follow this fee guide. I could completely ignore it. I could charge whatever I want for my services. If I thought that my filling was worth $10,000, I could charge you $10,000. But let's face it, that would probably be pretty bad business. So I choose to follow the BC fee guide so that my fees are fair and so that they won't differ greatly from other dentists in my area. I want to be competitive. I also, honestly, would not have a clue what to charge for my services if I didn't have some sort of guide. I need guidance. So this fee guide is also often the basis for how a lot of dental insurance plans will decide how much they're going to pay us for our services too. And it's really important as a healthcare provider to be really mindful of those third-party insurances, because Canada's a little bit different than some other places, especially compared to the United States. Our medical coverage is all government run, right? But dentistry somehow falls into this really weird gray area where we are fee for service. But thankfully, we're able to bill third-party insurance companies, and it's important, again, that we sort of understand how their pay structure reflects back on our fee guide so that we can kind of educate people about how that process kind of works. Anyways, while I can appreciate that Moonbeam 1303, I appreciate that this person understands that this business comes with a lot of overhead. But I want to let you all know that my fees, what we charge for our services, don't have much to do with my overhead or my cost. I just follow this sucker and let the rest of it all happen. I have this philosophy, like, do the dentistry, do good work, and the money will come. And so far, that philosophy has treated me very well. So I'm just gonna keep doing that. Anyways, so what I'm assuming most people don't know about the procedures that we bill is actually like what they mean, what their definitions are. So I want to review some of those common procedures involved in a routine dental cleaning and checkup. So first off, most of these procedures are time-based, meaning that for every 10 or 15 minutes we spend on a given procedure, we charge X amount. The average adult requires about 2 units of scaling and 1 unit of root planing. And these are the terms that we use to describe the physical removal of those hard deposits of tartar or plaque that are on your teeth, both above and below the gum line. Some people build up these deposits faster, some people have more mature deposits than others, so they take longer to remove, and some people come into the office more frequently so that we can access those deep pockets and make sure that we're removing all of those deposits, because removing those deposits removes the bacteria, which reduces your inflammation, which makes you healthier, and that's kind of the whole point of this whole game, right? So what I bet you don't know is that scaling and root planing is, like, the definition is not limited to just that physical action of removing those deposits from your teeth. It also includes the time that we spend doing other things like updating your medical history, our current COVID pre-screening and guidelines, administering anesthetic if that's what you need. And we don't charge extra for those materials, by the way. It also includes, probing, measuring your pockets, taking photographs, making sure that everything is up to date, and also talking about your oral hygiene technique, teaching you how to use a water pick, or you may end up spending time reviewing your diet and talking about how we might, recommend some changes, talk about systemic diseases like diabetes and high blood pressure and how that affects your oral health. We will educate you about those diseases and, take the time to book your upcoming appointments. So while I'm hoping that Moonbeam 1303 was exaggerating a little bit about getting a 15-minute cleaning, it's also possible that he or she has really good home care, not a lot of problems to talk about, and so had a really straightforward, quick kind of visit with us. And maybe this person didn't require as much of that time and discussion, or maybe he or she wasn't really thinking about how that time is allocated. So I won't know unless this person contacts me again. In addition, there are also a couple of other procedures that will go into an average dental cleaning. These are the polish and the fluoride. These are technically considered elective procedures. Not that I think that fluoride treatment should ever be considered elective if you have a high caries risk, because we have no fluoride in our water here in British Columbia, and the caries risk is incredibly high, especially in children. However, that is a controversial topic for a future date. This polish will remove gross plaque deposits, and it will polish your teeth, which is going to remove some surface staining and massage your gums and massage your tissues. We use this procedure, again, a lot in kids because they will typically have a lot more of that surface plaque than the hard tartar deposits. And the fluoride itself could be either a rinse or a varnish that we apply to those teeth. And it's beneficial not just to reduce your risk of cavities, but also if you have really sensitive teeth, it will help reduce that sensitivity. Okay, and the final procedures that we might perform at an average adult dental cleaning are the exam and x-rays. So Moonbeam 1303 mentioned only seeing the doctor for 2 minutes. And again, I'm gonna assume that there wasn't a lot of discussion that had to be had between her and the doctor, whether it was me or my associate, Dr. Whitelaw, I don't know. But, we don't like to take up a lot of your time in the dental chair if we don't have to, because most of you have places you would rather be. But I think, again, that maybe this person isn't accounting for the time correctly, because we actually do a lot of things behind the scenes. We don't like to spend more of your time than we need to. So For example, we take the time to review your medical and dental history before we see you. We read through your chart and look at your previous dental visits. We need to become familiar with what treatment you've had in the past and what you might need now. We have to check old and new x-rays. And if the hygienist has a concern, if they note something, they usually try to tell us ahead of time so that we have a chance to prepare and kind of get our thoughts in order. And this time is all part of the fee that we charge for that exam, which in 2020 is less than $30. So I do think that there is a true value to that, and that is not a bad thing. And just so you know, the x-rays are technically billed as their own separate procedure because of the time and expertise that's required, and they are often done by our assistants or hygienists, again, so that our time is managed very well and we have a chance to prepare before we start poking around in your mouth and figuring out what's going on. So once again, since I don't know who Moonbeam 1303 is, I can't look at his or her invoice and figure out what was billed, what happened at that appointment, and sort of explain where the money went. Although, strictly speaking, all of the procedures that I just discussed with you, including the scaling, root planing, polish, fluoride, exam, and x-rays, all amount to about $252.50 in 2020. But I understand, too, that money is a complicated subject, and I truly have a lot of empathy for people who can't rely on third-party insurance to cover some of the cost. Especially after the year we've had, COVID has not been kind to everyone. But I do really hope that this video might open someone's eyes to understanding the basics of our fee structure and how this works. And I also want to say that it is really, really important to ask questions. If you have a question about your invoice, about the procedures and how this works, please just ask. I have reached out to Moonbeam 1303 and asked for more information, and I will leave any sort of update in the comments below. But I wanted to ask for more information. I wanted to make sure that there wasn't some sort of billing error. We are human beings as well. Sometimes we will put something into our system that shouldn't be there, and I welcome the chance to find that mistake. So I guess at the very least, I got an idea for an interesting video, and I thank you all so much for watching. I really, really appreciate it. Let me know your thoughts in the comments below. Please be kind. And don't forget to like this video, subscribe to my channel, and above all, don't forget to go floss yourself.